Reid, welcome to the CIO Zone.
Thank you.
Tell our members and our audience a little bit about what you do, about your company, and what's going on this week that makes it so exciting for you here.
Sure. Thank you, Roger. So, my name is Reid Conant. I'm an emergency department physician primarily. I practice clinically at Tri-City Medical Center, which is in Oceanside, California, in North San Diego County. And for the past 7 years, I've been in the role at Tri-City as the Chief Medical Information Officer of my group, and have done a great deal of work with the hospital and the physicians and medical staff in deploying the Cerner EMR system. Along the way, we have deployed a successful CPOE system as well as physician documentation using structured documentation. Cerner's version of structured documentation is termed PowerNote. And along with PowerNote, we've found that Dragon Medical has been a very effective adjunct tool to aid in the adoption and creation of very high quality notes. So along the way, throughout those deployments, we found that we learned many things the hard way, frankly.
Well, of course.
So we managed to take those lessons learned and apply those to other organizations or assist in their deployment through those lessons learned. And we've worked with now about 35 to 40 physician groups and hospitals around the country in deploying physician documentation, incorporating Dragon as a critical component of that. So in working with physician groups and hospitals around the country, we've seen many ways to deploy physician documentation and have found that a critical component of this is the incorporation of speech recognition technology.
Right. Tell us a little bit about how speech recognition combined with a documentation program work together and what the benefits are to not only the physician but to the patient as well.
Sure. In this era of meaningful use, where organizations are striving to achieve the adoption of online physician documentation, the use of online physician orders, CPOE, the use of clinical decision support, and so many other menu items in the meaningful use criteria, it's critical that physicians are comfortable with the documents that they're creating online. Now that serves a couple of purposes. One is it allows for the use of direct clinical decision support tools. And in order to do so, you need to be able to gather discrete data, and that can be gathered through physician documentation, the use of problem lists, diagnosis lists, meds, allergies, etc. And that can be incorporated into physician documentation. Now, the tools that exist today are template-driven structured documentation elements. In order for physicians, we find, to be comfortable using structured documentation, we need to have a way to get that physician thought process and assessment, medical decision-making, and that narrative into the chart. And that's where Dragon comes into play. So these current online physician documentation tools, such as Cerner's PowerNote, are extremely powerful in terms of managing data, the ability to pull in current results, managing problem lists and meds and so on, and driving clinical decision support. However, physicians, if they're only using those tools, we find are not comfortable enough in generating that form of documentation.
Right.
So as a communication tool, there's a bit of a gap there in terms of the narrative, the thought process in communicating between providers. There's also the coding element of it. So to code at an appropriate level, there needs to be a complete enough document, enough thought process behind the data to justify the appropriate coding level. So all of those things come into play, and so we see that Dragon as an adjunct to the current structured documentation tools that are available. That Dragon as that adjunct is extremely powerful. One, it helps to create more robust and complete documentation, and two, it makes the physicians just more comfortable documenting online. So we see that the result is not, the dividend there to an organization is not just getting online physician documentation, but getting those docs into the system using the EMR so that they'll also use CPOE, clinical decision support, and the other pieces of meaningful use, electronic discharge instructions, etc. So it's a critical element, getting those physicians to be documenting online and to be comfortable with the documentation that they create.
And is this a large project for a practitioner or physician to get started with, or is this something that they can do relatively quickly and without a lot of expense.
The deployment of physician documentation is actually a fairly straightforward process if done in a thoughtful manner. So what we've found to work most effectively after working with 30 to 40 different organizations over the past 5 years is that we've taken a very much a workflow-based and EHR-based training approach. So we find that physicians who are gastroenterologists, let's say, document differently than an ambulatory internist versus an emergency department physician.
Makes sense.
And so the content is different, the process is different, even the geography and the mobility are different. So we find that the deployment of physician documentation can be done very successfully if done in a thoughtful manner. And a few things go into that. What we find is that taking a very much a workflow-based approach and an EHR-based approach to the training and the deployment makes a huge difference.
And this is where your experience in using it in real-life situations has really paid off.
Exactly. So initially, my company, Conant & Associates, CAI, we took those initial lessons learned, myself, colleagues, going through the grind and figuring things out the hard way. And we said, well, we can do this easier. We can help other organizations to streamline this process of adoption and deployment. And so then working with other facilities, we found that taking a workflow-based approach and an EHR-focused training approach makes all the difference. So by that I mean that taking the elements of Dragon, customizing Dragon and the EHR application to dovetail the two together is very effective, so that the physicians are more comfortable using Dragon because they've been trained on Dragon in their own environment. Okay, and they'll be using Dragon in training as they will going forward in their electronic medical record.
That makes a lot of sense.